I'm Dr. Pinakin Dave, Professor of Optometry and Director of Clinical Research at Western University of Health Sciences, and I've been practicing optometry for 22 years. Did you know that routine eye examinations can detect early signs of progressive, potentially life-threatening lysosomal storage disorders like Fabry disease and mucopolysaccharidosis I, also known as MPS I? Early detection and recognition of the signs and symptoms of these chronic genetic diseases is key in order to facilitate timely diagnosis and disease management. Ocular manifestations are among the earliest signs of Fabry and MPS I. Eye care professionals play a critical role in recognizing these signs. There are several ocular signs characteristic to Fabry disease, but corneal whorling or verticillata is one of the earliest and most common. It appears in children typically as young as 7 years of age and is present throughout the disease. Although not always obvious, corneal whorling can be detected using a slit lamp during routine eye examinations. The slit lamp needs to be carefully angled to view the corneal epithelium. Corneal whorling manifests bilaterally as a vortex of powdery white, yellow, or brown corneal epithelial deposits with rays emanating from a single point and sparing the limbus. Be sure to rule out medications that can cause corneal whorling with long-term use, including amiodarone and chloroquine. However, use of these medications should not immediately rule out any suspicion of Fabry disease. Patients with Fabry disease are at risk of cardiac conduction abnormalities and may be treated with amiodarone, which is an antiarrhythmic drug. It's important to also note, while Fabry disease has an X-linked inheritance pattern, females are not just carriers. 69% of the females show signs and symptoms of Fabry disease. In MPS I, corneal clouding is one of the most common and early signs seen in approximately 70% of the patients. Depending on the severity of corneal clouding, the slit lamp examination may reveal a ground glass appearance. Other ocular manifestations of MPS I may include retinopathy, optic nerve abnormalities, and visual impairment. So if you detect corneal whorling, consider Fabry disease. If you see corneal clouding, include MPS I in your consideration and refer your patient to a specialist such as a geneticist for testing as soon as possible. Timely referral to a geneticist is important to potentially reduce diagnostic delays. This allows for earlier initiation and appropriate disease management for these progressive and potentially life-threatening disorders.